Welcome to this lectures and topics. Our lecture today is going to be about ultrasound. The first part is going to be about basics of ultrasound and the sound in general. The second part is going to be about what is and how to use the parameters of ultrasound to obtain the optimal therapeutic effect. Let's begin our first part by understanding how ultrasound or sound is produced. So let's talk about this headphone, in which the mechanism of production of sound from this headphone is similar to the mechanism of production of sound from the transducer head, not a sound device. So let's go step by step. Let's first look about this wire. The current or electrons in this wire is called alternating current, not direct current, and you will know why it is not direct current. The electrons and atoms in alternating current move in different phases. In first phase, they will move forward toward the transducer head or the earpiece. Then they will return back to the original position. Then they return backward past the original position. Then they return to the original position again. Each atom or electron across the wire will do the same thing. If I want to draw a graph representative to the alternating current, the graph will be like this. First, the electron moves forward. This is the original position of electron or atoms. The electron moves forward, then it returns back to its original position. Then it moves backward past the original position, so they will move. So I will draw this in the opposite direction. Then they will move and return back to the original position again. And this wave is called sinusoidal wave or sine wave. Sine wave have some characteristics. First is wavelength, which is the distance covered by this wave from this point to this point, which is equal to the summation of all the distance covered by the electron along its pathway. So equal to summation of this distance and this distance and this distance and this distance too. So all the motion done by the electron or atoms in one wave is equal to wavelength. Frequency is equal to how many times the electron do the same motion in 1 second. So frequency is equivalent to number of cycles or number of waves per second. Intensity or amplitude which represent this area from the top to here. This is called the amplitude or the intensity. It represents how was the velocity of the atoms during performing this motion. Was it very fast or low? The faster or the more the velocity it has, the more the amplitude will be the curve, the more larger. For example, if I have a current now with a velocity of 20 meters per second, the current was 10 meters per second, and both have the same frequency, so both have the same wavelength. If I want to draw a graph, it will be like this. The change in the amplitude represents change in the velocity of the electrons. Finally, at the end of the wire, there is a transducer head or the earpiece in headphones. Inside this transducer head or earpiece, the wire form a coil around a material. So this is going to be a material, and the wire is forming a coil around it. In earpieces, this material is speaker, while in ultrasound, this material is crystal. Most of these materials have a common characteristic, which is piezoelectric phenomena. Which means that it is the ability of the material to change its shape or vibrate when alternating current passes around it or through it, and vice versa. It is the ability of the material to produce alternating current when it is vibrated or change its shape. So, when this current will move in the coil, it will form changing structures of this material, which is speaker or crystal. First, the material, when electrons move forward, will cause expansion of the material. When the electrons return back to the original position, the material also returns back to its original position. When the electrons pass past the original position backward, the material will shrink. When the electrons return back again to the normal position, the material also will return to the normal position. If I want to draw a graph for the changing or vibration of the material, it's going to be like this, which is similar to the alternating current, because the alternating current is the source of producing the changes. So any changes in the alternating current will cause a changes too in the vibration and the graph of crystal or speaker. We call this shape by sound wave. So vibrations of these crystals or speaker will produce a sound wave, which is graph is be like this. And sound wave also have characteristics like alternating current. First, wavelength, and second, frequency, which is number of waves per second, and finally, intensity and amplitude. So there are two prerequisites to produce sound wave or ultrasound. First, you must have an alternating current, not direct current, because in direct current, electrons will not move like this. Electrons only will move forward. So when this current moves inside the coil, it will not form a deformation or changing in the shape of the crystal. The second prerequisite is a material that has a piezoelectric phenomenon. If I am using alternating current, but using a material that doesn't have piezoelectric phenomena, when alternating current passes inside the coil, it will not form changing in the shape of the crystal. So the two prerequisites to get ultrasound is to have alternating current to produce sound wave, and the second is having a material that can change its shape when alternating current passing through it. According to frequency, we categorize the sound into three categories. First, audible sound, and second, infrasound and ultrasound. Both infra and ultrasound, human ear can't hear it, while audible sound, human ear can hear it, which ranging from 16,000 hertz to 20,000 hertz, while ultrasound ranging from 4.25 to 3.3 megahertz. In physiotherapy, when we're using ultrasound, we use frequencies ranging from 1 to 3 megahertz. Human ear can't hear the sound, a pet can hear the sound. In using parameters of ultrasound, one of the parameters that you must understand is frequency. In ultrasound, there is a relationship between frequency and diffraction. Diffraction is the ability of the sound to bend over the corners. The less the frequency, the more the diffraction the sound has. So infrasound has more diffraction than audible sound, and audible sound has more diffraction than ultrasound, and inside ultrasound 1 megahertz has more diffraction, more than 3 megahertz. More than 3 megahertz. To understand what is diffraction and how it is important in ultrasound therapy, we must see this graph. If I'm using an ultrasound transducer with one producing sound waves with 1 megahertz and the other produce sound waves with 3 megahertz, and both of them are facing obstacle, what will happen when they face this obstacle according to diffraction? Since diffraction is the ability of the material to bend over, and since 1 megahertz has less frequency than 3 megahertz, so more diffraction, sound waves will move around this obstacle with a little amount will move inside this obstacle. While in 3 megahertz, since it has a large frequency and less diffraction, it will not able to diffract, to converge, or move around the obstacle, and will pass inside it. So when it passes inside the obstacle, it will lose some of its energy inside the obstacle, while 1 megahertz preserved its energy, and this amount of energy is absorbed inside the obstacle. If I want to compare between 1 megahertz and 3 megahertz, the comparison will be like this. Despite that, the transducers produced a collimated waves of 1 megahertz and 3 megahertz, but the ability of 1 megahertz to diverge around the obstacles make it increase its size after passing around the obstacles. While in 3 megahertz, due to having the ability to diverge and move around the obstacles, it remained collimated. So 3 megahertz have a collimated waves, while 1 megahertz has a divergence wave. Since 1 megahertz don't penetrate the obstacles, preserve its energy, so with this large amount of energy it can move a further distance. While 3 megahertz, due to loss of most of energy in obstacles, this amount of energy will remain to move a further distance. So 3 megahertz can reach to 2-3 centimeter, while 1 megahertz can reach to 5 or more centimeter. Since also 1 megahertz don't penetrate the obstacle, so it doesn't lose its energy, while in 3 megahertz it lost its energy to the obstacles. Since this is a kinetic energy, and energy nor created nor destroyed. So the kinetic energy will be converted to heat. So 3 megahertz will produce more heat than 1 megahertz. So more heat, less heat. So if I'm using two transducers, both of them have the same intensity, the same duration, treating the same region at the same depths with different frequencies, 3 megahertz will cause a great heatness of the region than 1 megahertz, because more of its energy is absorbed while 1 megahertz less of its energy is absorbed. This is a very important comparison because we need it during measuring of the parameters of ultrasound, so we must know it. After understanding how ultrasound waves is produced from crystals, let's now know how ultrasound is propagated across the medium. Before understanding how ultrasound propagates, first let's know what ERA means. If you notice now the diameter of the earpiece, you will find that this diameter is smaller than the diameter of the earpiece after removing the area that doesn't produce the sound. So this area only will produce the sound, while in this diameter, not all this diameter will produce the sound. So we call the only area that produces sound in the earpiece or the transducer head by effective radiating area. So the transducer head, if this is the transducer head, so effective radiating area would be always smaller than the transducer head, because not all the transducer head will produce a sound. It is very important to differentiate between effective radiating area and transducer head. Effective radiating area will always be smaller than transducer head. And also, you must know how much is the differences between the lesion part and effective radiating area. If you are treating an area which is double than the effective radiating area, you will need more time. If you are treating an area with an effective radiating area is equivalent to the lesion. A very important part too, smaller effective radiating area will produce a diversion ultrasound, while larger effective radiating area will produce a collimated ultrasound. A clinical practice note: if you are treating a trigger point, you will use a larger ERA to focus the ultrasound waves to the trigger point. Finally, let's talk now about how the sound ultrasound is propagated through the media. So if I'm taking a cross-sectional area of the crystal or the speaker and looking from above, I will see the crystal is like this, and particles at the microscopic level. If this is the ear, if this is my ear, if I'm talking about headphones, or if this is target tissue I want to treat, and this is the stainless steel. and constancy, and all this is a medium. For example, in hand freeze, it is like it is air, or in ultrasound, it is a coupling medium. And so on, so on, so on. So when the ultrasound crystal or speaker in headphone expand, it will push this molecule or atoms forward. So when expansion occurs, these atoms will move forward. So this is another crystal here. So atoms here moved forward, pushing the other atoms, and the other atoms move forward to push the other atoms. And this compression force and pushing force move from layer to layer to layer to reach the target area, which is eardrum, and cause a vibration of the eardrum or target tissue, and cause vibration or kinetic energy at the level of the target tissue. So after this compression, so compression with atoms also will happen. Compression forces, pushing along the way. When the crystal now shrink, as the atoms move backward, you will notice that there is now a large distance between the atoms of the stainless steel and the crystal. So this low pressure area will cause attraction force and pulling of these atoms backward. So these atoms will move backward. And the remaining atoms is still in compression state. So when these atoms will move backward, this space now is gonna be filled with the atoms here. But the atom now leave its place, so this space which is become empty by this atom due to this atoms move backward by the pulling force of low pressure. The space now is gonna be a low in pressure. So the atoms which is in compression state now will move backward by the pulling force and fill this space. And when they become here now and they fill this space, their space will now become empty with low pressure. So the atoms which is in compressing state will pull backward again to this place to fill it by the atoms. And this motion of compression and rarefaction will continue along this pathway from the source of the sound to the target tissue, which will cause the eardrum to vibrate first back forward because the atoms pushing it forward. Then when these atoms will return backward due to the low pressure state, the eardrum or the target tissue will move backward too. So sound waves, which is similar to alternating current will move along the medium and propagate along the medium by a longitudinal wave, which is a mechanical wave and actually also a pressure wave, because the propagation is occurred due to motion of the atoms in the pressure tube. A very important thing you must understand: the non-thermal effect of ultrasound is produced due to this compression in the low pressure area, which is this rarefaction. When there is a low pressure area, lead to increase the space and formation of gas bubbles. Like example, manipulation at the joint. Now, if I'm pressing at the joint, I'm increasing the joint space. When I'm increasing the joint space, there is gonna be a low pressure area in the joint space, which will pull and attract the air gas, which is dissolved in the synovial fluid, and make them to form a bubbles. If I'm increasing the pressure on the joint, I'm increasing more and more the joint space and forming a larger and a larger bubble. And as finally, it is gonna explode. And this is the same mechanism which happens here at the level of the tissue, as a target tissue. It is like a balloon. I can blow up the balloon. If I blow up slowly, it will increase in size. And if I move my mouse away, it will shrink again. But if I blow up it very large, it will explode. This is the same mechanism here in non-thermal effect of target of ultrasound. We call it ultrasound cavitations. If the cavitations or bubbles is small and didn't explode, we call it stable cavitation. If the bubbles explode, like I did to my BIP joint, it will cause a micro explosions around the soft tissue, which may lead to damage to the soft tissue. We now know what is meant by ERA. We now know what is meant by frequency. Let's now know what is meant by BNR. As I told you, the atoms of the crystal will push the atoms of stainless steel, and the atoms of stainless steel with the transducer or the earpiece will push the atoms across the medium till it reaches to its target. So, unfortunately, the speaker or crystal is not a pure material. It has an imperfection, which means that not all atoms will push the stainless steel atoms by the same intensity or amplitude. Some atoms will be a very fierce atoms, which will push the atoms very strong. So, since very strong means that the amplitude is increasing. So, in some area of the crystal, there is actually a very large velocity and very large intensity or amplitude of waves. Let's say this is, for example, we call this by beam non-uniformity ratio, which means that I want to know what is the ratio of this high fierce and very strong current in the crystal or earpiece comparing to the normal current in the transducer or crystal. If the ratio is 1 to 2, for example, this means that if I'm operating my ultrasound device at 0.3 megahertz, at 0.3 watt per centimeter square, this means that there is a some area in the crystal which reduce an intensity with multiply 2 by 0.3 multiply reduce an intensity with watt per centimeter squared, while the remaining of the area is producing 0.3 watt per centimeter squared. So it is very safe to use an panel which is beam non-uniformity ratio to up to 1:5 ratio, because more than 1:6 it will limit you to use high intensity during ultrasound therapy. A 1:8 ratio is unsafe. So if you are buying a device from 1:6, 1:8 panel, I suggest not to buy this device because it will limit you from using high intensity current. A very important thing now, the cavitations which happen is in direct relation to the intensity. The higher the intensity is, the higher the cavitation is. So in acute stage, due to the soft tissue is so soft and delicate and weak, I don't use a very high intensity from feeling that this cavitation may cause damage to this delicate soft tissue. So I use an intensity with 0.3 to 0.1 to 0.3 watt per centimeter squared. In subacute tissue, soft tissue is now more stronger than acute soft tissue. So I use 0.2 to 0.5 watt per centimeter squared. In chronic stage, I use from 0.5 to 1 watt per centimeter squared. Remember this point because we need it when I'm going to use parameters of ultrasound. Now, let's return back to the panel. This is a strong wave which is represent some part of the intensity which is very fierce and very strong sound wave. To avoid this strong wave, a strong part of ultrasound, to reduce a hot spot, we make a rotation of the ultrasound device. One of the main reasons of doing rotation of ultrasound device is the panel, to avoid hot spots. After now understanding how sound is propagated and how sound is produced, let's now talk about how to use parameters of ultrasound.